Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Let's discuss today's topic. Today we are going to take the topic the hormone estrogen's effect on the mental health of a female. Okay, let's go. The hormone estrogen has a powerful and direct effect on mental health of female. It influences mood, anxiety, memory, and even vulnerability to depression in sometimes. So let's look it clearly. Estrogen and mood regulations. Estrogen helps to regulate key brain chemicals. One is serotonin, which is responsible for happiness, emotional stability, etc. The other chemical dopamine, which is responsible for motivation, pleasure, etc. The next chemical norepinephrine, which leads to focus and alertness. When estrogen levels are stable, many women feel emotionally balanced, mentally clear, and more resilient to stress. When estrogen drops suddenly, mood can shift quickly. Now let's look into low estrogen level and mental health symptoms. Low estrogen level states occur during the times like premenstrual phase, postpartum, perimenopause, and menopause. Common mental health effects of low estrogen are irritability, anxiety, low mood, crying spells, you may feel like a brain fog, poor concentration, and sleep disturbances. This is why conditions like PMDDs happen. The brain is very sensitive to hormonal shifts. Let's look into the next point, estrogen and menstrual cycle. During the cycle, follicular phase, that is after the period, estrogen rises. So this results in improvement of mood. Next, the ovulation occurs. That's the time when the peak of the estrogen level occurs. So that time the mental health or the effect of the mental health due to this peakness of the estrogen or hormone is you feel more confident, you will be more energetic, or you have more energy. Sometimes you may feel more sexually desired or you feel higher libido. Okay, then the next phase, luteal phase, that's the phase, that's the time period just before period. So that time the estrogen level drops down and the mood sensitivity, the mental health, the effect of mental health as a result of that is your mood sensitivity increases. So that's what happening in your menstrual cycle due to the estrogen levels. So it's like a curve and reaches the peak when the time of ovulation level, when the time of ovulation and then drops down. That is how the estrogen is working in your cycle or in your menstrual cycle. For the woman over 35 years, hormonal fluctuations can feel stronger because the cycle become less predictable on that period. So next point, estrogen and anxiety. What is estrogen doing to your mind is that estrogen, the hormone estrogen, calms the stress responses, reduces the overactivity in amygdala, that is fear center of your brain. As a result, low estrogen levels can increase the panic symptoms, or you may feel panic attacks if you have low estrogen levels in your body. Next effect of low estrogen level is increase the intrusive thoughts. So the low estrogen also increases the emotional reactivity. This is why anxiety often worsens before menstruation or during perimenopause time. Now, the next point, estrogen and depression. Research shows major depression risk increases during hormonal transition. Postpartum depression is linked to sudden estrogen drop, and perimenopausal women have higher depression risk. Keep in mind, estrogen doesn't cause depression alone, but it can trigger the vulnerability in someone already predisposed. Okay? Now, cognitive effects. Estrogen supports memory, verbal fluency, mental sharpness. The low level of estrogen can cause brain fog, word finding difficulty. So, sometimes if you explain low levels of estrogen can cause word finding difficulty. So if you are in the middle of a talk or something, or if you are describing something to to someone, you may feel you couldn't find the exact word to describe what you are going to talk about. So that's also an effect of low level of estrogen in your body. Now, next effect is reduced mental clarity. Many women describe this during perimenopause time. Let's look into important balance. Too much estrogen relative to progesterone can also cause mood swings, irritability, heavy periods, breast tenderness. So, balance is more important than just high or low. Now, let's discuss about how you can manage the low estrogen levels in your body. So, first point is confirm the cause first. Low estrogen level can occur due to perimenopause or menopause, chronic stress, excessive fasting or under eating, very low body fat, postpartum, thyroid imbalance, and certain medications. A doctor may check estradiol, that is E2, FSH, LH, and thyroid panel to determine your estrogen levels in your body. So, let's look into nutrition that supports estrogen production. Your body needs adequate nutrition to make hormones. Healthy fats, that is avocado, olive oil, nuts and seeds, fatty acids, are good supplements for making estrogens because the cholesterol is the building block of the estrogen. Proteins. Aim for sufficient daily protein support for hormone signaling. Okay. Phytoestrogens, mild plant estrogens, flax seeds, soy products like tofu, chickpeas, sesame seeds, etc. are good for phytoestrogens, that is, plant estrogens. These can gently support estrogen receptors. Now let's come to next point, reduce chronic stress. High cortisol suppresses the reproductive hormones. You should reduce your stress levels, and helpful practices for reducing the stress levels are 7 to 8 hours of sleep daily, gentle exercise like walking, yoga, etc. Avoid overfasting if hormones are already low. Mindfulness or prayer especially helpful during the spiritual fasting seasons. Now let's look into next point. Strength training. Resistant training improves insulin sensitivity, supports hormonal balance, and protects bone health. Every 2-3 sessions per week helps to regain your strength. Now let's come to the medical option. This is the option only for symptoms are significant and disturbing. If symptoms are moderate to severe, like hot flushes, depression, vaginal dryness, severe mood swings, then hormone replacement therapy is taken. That includes estradiol patches or pills or gels, often combined with the progesterone. Very effective for hot flushes, sleep issues, mood instability, and bone protection. This must be prescribed and monitored by a physician. Now let's look into next option, vaginal estrogen. This is for if the symptoms are local. Like if you feel dryness, painful intercourse, recurrent UTIs, then low doses of vaginal estrogen is very safe and acts locally. Now let's look into supplements. Some women explore vitamin D, magnesium, omega 3. These support symptoms but don't directly raise estrogen strongly. You should always check with a provider before starting herbal hormone therapies. So, now let's come to the point when you should see a doctor. Seek evaluation if you are having your period stopping before the age of 45, severe depression or anxiety, night sweats that disrupts your sleep, bone pain or fractures, sudden major cycle changes, then you should seek medical attention immediately. So, important reminder for you that low estrogen is not just about reproduction. It affects brain, bones, heart, skin and libido. So treatment should match your symptoms and life stages. That's all about today. Let's stop over here and we will come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.